Question 1. What is the nurse's first step before administering an unfamiliar form medication? A. Confirm the dose with another nurse. B. Ask the patient if they have taken it before. C. Consult a drug reference or facility guidelines. D. Administer slowly and observe for effects. Answer. C. Consult a drug reference or facility guidelines. Question 2. A nurse is administering insulin aspart. What is the priority nursing action? A. Confirm the patient's hemoglobin A1C. B. Make sure food is available and patient is ready to eat. C. Hold if the blood glucose is above 180 milligrams per deciliter. D. Mix it with long-acting insulin in the same syringe. Answer. B. Make sure food is available and patient is ready to eat. Question 3. What must the nurse assess prior to administering a beta blocker? A. Blood glucose and bowel sounds. B. Temperature and oxygen level. C. Heart rate and blood pressure. D. Pain level and urine output. Answer. C. Heart rate and blood pressure. Question 4. Which type of medication error is most likely when two medications look alike and are stored close together? A. Omission error. B. Substitution error. C. Transcription error. D. Dosage calculation error. Answer. B. Substitution error. Question 5. What is the most appropriate nursing action for a patient receiving a high alert for medication? A. Ask the patient if it looks correct. B. Verify with another licensed nurse. C. Administer based on previous shift's documentation. D. Skip checking the label if it's a routine med. Answer. B. Verify with another licensed nurse. Question 6. A patient is prescribed a nephrotoxic drug. What should the nurse monitor? A. Liver enzymes. B. Serum creatinine and urine output. C. Electrolyte panel only. D. Blood pressure hourly. Answer. B. Serum creatinine and urine output. Question 7. What action should a nurse take when a patient has difficulty swallowing large pills? A. Split or crush all pills before giving. B. Skip the dose until the next one. C. Notify the provider to request an alternative form. D. Dissolve them in juice and administer. Answer. C. Notify the provider to request an alternative form. Question 8. What is a key element of safe discharge teaching for anticoagulants? A. Avoid foods high in fiber. B. Take the medication with grapefruit juice. C. Report signs of bleeding such as bruising or tarry stools. D. Double the dose if one is missed. Answer. C. Report signs of bleeding such as bruising or tarry stools. Question 9. A nurse administers a medication 1 hour late. What should be done next? A. Skip documentation. B. Notify the provider and document the late administration. C. Change the time on the march. D. Omit the next dose. Answer. B. Notify the provider and document the late administration. Question 10. When should the nurse use the 3 checks of medication administration? A. Before entering the patient's room only. B. Only after scanning the medication. C. Before, during, and after preparation of medication. D. Only when giving high-risk drugs. Answer. C. Before, during, and after preparation of medication. Question 11. A nurse must administer a subcutaneous injection of enoxaparin. What is the correct technique? A. Massage the site after injection. B. Aspirate before injecting. C. Administer into the abdomen without rubbing. D. Inject into the deltoid muscle. Answer. C. Administer into the abdomen without rubbing. Question 12. A patient refuses medication stating, "This doesn't look like what I usually take." What is the nurse's best action? A. Reassure and administer the drug. B. Tell the patient they are mistaken. C. Verify the medication and order before proceeding. D. Leave the medication at the bedside. Answer: C. Verify the medication and order before proceeding. Question 13. What is the nurse's responsibility when receiving a medication error report from pharmacy? A. Administer the drug to avoid delay. B. Confirm the correct medication and clarify discrepancies. C. Contact the patient's family immediately. D. Hold all medications until next shift. Answer: B. Confirm the correct medication and clarify discrepancies. Question 14. Which type of insulin cannot be mixed in the same syringe with any other insulin? A. Regular insulin. B. NPH insulin. C. Insulin glargine. D. Insulin lispro. Answer: C. Insulin glargine. Question 15. A patient reports nausea after taking prescribed oral antibiotics. What should the nurse do first? A. Hold the next dose. B. Notify the healthcare provider. C. Give with food if allowed and reassess. D. Switch to 4-form. Answer: C. Give with food if allowed and reassess. Question 16. Which patient should the nurse see first related to medication safety? A. A patient receiving 4 fluids at 125 milliliters per hour. B. A patient receiving 4 potassium who reports burning at the site. C. A patient taking acetaminophen with a mild headache. D. A patient who just finished oral antibiotics. Answer: B. A patient receiving 4 potassium who reports burning at the site. Question 17. A nurse is preparing to give an IM injection to an adult. Which site is preferred? A. Deltoid. B. Dorsogluteal. C. Ventrogluteal. D. Vastus lateralis. Answer: C. Ventrogluteal. Question 18. What is the purpose of a black box warning on a medication? A. To indicate it's for pediatric use only. B. To note potential for abuse. C. To highlight serious or life-threatening risks. D. To identify non-formulary drugs. Answer: C. To highlight serious or life-threatening risks. Question 19. A nurse is teaching a patient about nitroglycerin. Which instruction is correct? A. Take with a full glass of water. B. Store in a warm, moist place. C. Keep in the original container away from light. D. Swallow the pill whole. Answer: C. Keep in the original container away from light. Question 20. A nurse notes a medication is ordered PRN for pain. What must be assessed before giving it? A. Whether the pharmacy delivered the drug. B. The provider's phone number. C. The patient's reported pain level and last dose time. D. The nurse's opinion of the patient's pain behavior. Answer: C. The patient's reported pain level and last dose time. Question 21. A patient is receiving heparin and develops blood in the urine. What is the nurse's best action? A. Continue therapy and monitor labs. B. Notify the provider and stop the medication. C. Administer protamine sulfate immediately. D. Withhold fluids to reduce urinary output. Answer: B. Notify the provider and stop the medication. Question 22. A nurse must administer medications to a patient with dysphagia. Which is the safest method? A. Crush all medications and give with water. B. Mix crushed meds with pudding. C. Check for liquid alternatives or consult pharmacy. D. Skip any large pills. Answer: C. Check for liquid alternatives or consult pharmacy. Question 23. Which practice increases the risk for medication administration error? A. Using tall man lettering on labels. B. Administering meds before documentation. C. Preparing medications in a distraction-free area. D. Using a barcode scanner for verification. Answer: B. Administering meds before documentation. Question 24. Which patient condition requires close monitoring when administering morphine? A. Constipation. B. Asthma. C. Hypertension. D. Hyperthyroidism. Answer: B. Asthma. Question 25. A nurse must administer a unit of insulin that is cloudy. What is the correct action? A. Shake the vial vigorously. B. Roll the vial gently between palms. C. Mix with clear insulin in the vial. D. Warm it in the microwave briefly. Answer: B. Roll the vial gently between palms. Question 26. What should the nurse assess prior to giving a nephrotoxic medication? A. Hemoglobin level. B. Creatinine and BUN levels. C. Red blood cell count. D. PT/INR results. Answer: B. Creatinine and BUN levels. Question 27. Which task can be delegated to a UAP regarding medications? A. Reporting patient complaints about side effects. B. Administering over-the-counter medications. C. Documenting effectiveness of narcotics. D. Educating on new prescriptions. Answer: A. Reporting patient complaints about side effects. Question 28. What is a nurse's first action when a patient is prescribed 2 medications with known interactions? A. Administer both and monitor closely. B. Contact pharmacy and notify the provider. C. Document the interaction and hold both drugs. D. Reduce the dose of both drugs. Answer: B. Contact pharmacy and notify the provider. Question 29. A nurse is administering warfarin. Which lab results should be reviewed first? A. Hemoglobin. B. Point/INR. C. Platelet count. D. APTT. Answer: B. PT/INR. Question 30. Which action by the nurse supports safe practice during medication reconciliation? A. Relying solely on patient report. B. Verifying all medications with pharmacy and prior records. C. Assuming continuation of all home meds. D. Adding supplements based on patient preference. Answer: B. Verifying all medications with pharmacy and prior records. Question 31. What is a critical teaching point for a patient on lithium therapy? A. Limit salt intake drastically. B. Monitor for signs of dehydration. C. Take the medication with grapefruit juice. D. Avoid dairy products. Answer: B. Monitor for signs of dehydration. Question 32. A patient receiving a new antihypertensive experiences dizziness. What is the priority action? A. Reassure the patient it will resolve. B. Hold the next dose and notify the provider. C. Double the fluid intake. D. Document and continue therapy. Answer: B. Hold the next dose and notify the provider. Question 33. Which medication route has the highest risk for infection if not handled properly? A. Oral. B. Intramuscular. C. Intravenous. D. Rectal. Answer: C. Intravenous. Question 34. A patient reports tightness in the chest after an 4 antibiotic. What is the nurse's best first action? A. Reassess in 30 minutes. B. Slow the infusion rate. C. Stop the infusion and assess ABCs. D. Call the pharmacist. Answer: C. Stop the infusion and assess ABCs. Question 35. A nurse finds a narcotic discrepancy in the count. What is the next appropriate step? A. Ignore if the count is close. B. Notify the charge nurse immediately. C. Check back tomorrow. D. Leave a note for the night nurse. Answer B. Notify the charge nurse immediately. Question 36. A nurse gives a medication to the wrong patient. What is the first action? A. Fill out an incident report. B. Assess the patient for adverse effects. C. Notify the pharmacy. D. Call the provider directly. Answer B. Assess the patient for adverse effects. Question 37. Which patient is at highest risk for drug toxicity? A 25-year-old male athlete. B. A pregnant woman in the second trimester. C. A 10-year-old with a normal creatinine. D. An 82-year-old with decreased renal function. Answer D. An 82-year-old with decreased renal function. Question 38. When administering a topical ointment, what is the correct technique? A. Use a sterile glove and rub vigorously. B. Use bare hands for better accuracy. C. Apply using gloves or applicator to avoid contact. D. Cover with tight plastic wrap. Answer C. Apply using gloves or applicator to avoid contact. Question 39. Which step is essential before administering for chemotherapy? A. Ensuring the patient ate a full meal. B. Confirming 2 nurse signatures. C. Checking vital signs after administration. D. Administering it through a peripheral 4. Answer B. Confirming 2 nurse signatures. Question 40. Which of the following is a nursing safety priority when administering a diuretic like furosemide? A. Monitor for bradycardia. B. Assess for hypokalemia and dehydration. C. Encourage unlimited fluid intake. D. Restrict all sodium-containing foods. Answer B. Assess for hypokalemia and dehydration. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.